Okay, let's talk about something you hope you'll never have to deal with, a dental emergency. But look, when one strikes, those first few minutes are absolutely everything. What you do right then and there can literally be the difference between saving a tooth and losing it forever. So, welcome to your Dental 911 explainer. All right, just imagine this for a second. Maybe it's a fall on the pavement, a stray elbow in a game, and bam, a tooth is knocked clean out. Your first instinct is probably pure panic, right? But here's the thing, you can't afford to panic because the clock just started ticking and every single second counts. So how much time do you have? This right here, 30 to 60 minutes. This is the golden rule of saving a tooth. It's your window. If you can get that tooth back where it belongs within an hour, you've got a great shot. But after that, the chances of saving it, they plummet. Seriously, time is the most important factor here. Okay, let's get right into it. We're going to tackle the big one first, the knocked out tooth. Now, this isn't about scaring you. It's the opposite. It's about giving you a simple step-by-step survival guide so you know exactly what to do in a really stressful situation. First things first, and this is maybe the most important part, how you pick that tooth up. You have to, and I mean have to, grab it by the crown, the white part you chew with. Do not touch the root, that pointy yellowish part. Why? Well, that root is covered in these super delicate little cells that are basically the life support system needed to reattach it. If you touch them, you can kill them. And if they're dead, the tooth can't be saved. It's that simple. Okay, so you've picked it up the right way. Now what? Here's your 3-step game plan. Step 1. If it's dirty, give it a quick, gentle rinse. We're talking 10 seconds tops. Use a little milk or water. Absolutely no soap, don't scrub it. Step 2, and this is the best case scenario, is to try and put it right back in the socket. Just gently push it in, then have the person bite down on some gauze or a clean cloth to keep it in place. Now, if you can't do that, maybe you're just not comfortable, that's okay. Don't force it. Just move straight to step 3. So how do you store it safely? The number one best option is a little container of cold milk. It sounds weird, I know, but there's a reason. Milk has this perfect balance of stuff, the pH, the proteins, that keeps those delicate root cells alive. It's like a little life raft for the tooth. If you don't have milk, a little bit of their own saliva is the next best thing. But listen to this. Whatever you do, do not use plain tap water. It seems logical, but it's the worst thing you can do. The water actually makes the cells on the roots swell up and burst. Game over for the tooth. Okay, hold on a second because this next part is super, super important. Everything we just talked about, that's for adult teeth, permanent teeth. If a little kid knocks out a baby tooth, you do not, under any circumstances, try to put it back in. You could actually do some serious damage to the permanent tooth that's growing up in the gums. So for a baby tooth, just find it, keep it, and call the dentist. All right, let's shift gears a bit. We're going to move away from the super dramatic knocked out tooth and talk about stuff that's way more common, but still a pain. You know, those things that always seem to happen at the worst possible time? Like 5:30 on a Friday. We call them Friday night disasters. So you're out to dinner having a great time and you bite down on something crunchy. Except it wasn't supposed to be crunchy. Oh no, it's your crown. So embarrassing, right? But don't panic. There's a little hack for this. You can actually use a teeny tiny dab of toothpaste or, even better, some denture adhesive to temporarily stick it back on. It's not a permanent fix, of course, but it'll definitely get you through the rest of the night. But, and this is a huge but, I know what you might be thinking. Why not just use a drop of superglue? Do not do it. Please, I'm begging you. Superglue is toxic, for one thing. And for another, it'll make it basically impossible for your dentist to fix the tooth properly. You'll take a simple problem and turn it into a massive, expensive nightmare. Just don't. Okay, anyone who's ever had braces knows this pain, that one rogue wire that decides to start poking you in the cheek. It's so annoying, but the fix is actually really easy. First, grab a pencil with an eraser on the end. Use the eraser to just gently push that wire back down so it's flat against your tooth. Then, to make sure it stays put, cover it with a little bit of that orthodontic wax. And hey, if you're in a real pinch, a little piece of sugar-free gum works too. Now, let's talk about maybe one of the worst feelings in the world, a really bad toothache. I mean, the kind that wakes you up in the middle of the night, just throbbing. Your mind immediately goes to the worst case scenario, right? A cavity, an abscess. But you might be surprised what's really causing it. So picture it. It's 2 in the morning. The pain is just awful. What's the very first thing you do? Seriously, think about it. Are you reaching for the ibuprofen? An ice pack? What's your gut reaction? Okay, you ready for this? For a lot of people, this is a total game changer. The very first thing you should do is floss. I know it sounds too simple, but get this. Maybe half of all toothache emergencies aren't from a cavity at all. They're from a tiny piece of food, like a popcorn kernel shell, that's stuck under your gums. If you can floss it out, the relief can be almost instant. After you floss, a good rinse with some warm salt water is a great idea to soothe everything. So you've probably heard this one, right? It's one of those old remedies that gets passed around. Oh, you have a toothache? Just stick an aspirin right on the gum next to it. It kind of makes sense on the surface, but it is a terrible, terrible idea. Here's why. Aspirin is acetyl salicylic acid, and when you put that acid directly on the soft tissue of your gums, it doesn't just numb the pain, it gives you a chemical burn. Dentists actually have a name for it, an aspirin burn. And trust me, it's way more painful than the original toothache. So please remember, painkillers are meant to be swallowed, period. Okay, so we've walked through a few different emergencies, but in that moment of chaos, there's always one big question. Who do I even call? Do I go to the emergency room? Do I call my dentist? It can be confusing, but the answer is actually really simple. Here's how you decide. Think of it this way. You go to the ER for big, potentially life-threatening stuff. We're talking a broken jaw, bleeding you can't get to stop, or any swelling that makes it hard to breathe. For pretty much everything else, the knocked out tooth, the lost crown, that awful toothache, you call your dentist. They're the ones with the right tools and the right training to fix the actual dental problem. And there you have it. That's your Dental 911 toolkit. So let's recap the big ones real quick. Remember the golden rule, you've got 30 to 60 minutes. Use the milk trick to save a tooth. For a crown, use the crown hack, not the super glue. Never, ever create an aspirin burn. And if you get that crazy toothache, floss first. It might just save you a trip. Look, knowing this stuff can take a moment that feels like total chaos and turn it into a situation you have under control. Accidents are going to happen. That's just life. But now, when one does, the only question is, are you ready to save a smile?